Greetings to all of you on behalf of the Ministry of Health and Family Welfare. At the outset, I would also like to thank the National Center for Advanced Research in Dietetics for organizing this. You're all aware that the so-called the NCEARD services remains a very essential services, and keeping that point, India has issued few guidelines, and they have considered the maternal and child health services as the essential services. Now, I will try to elaborate on what has been the government perspective in the context of care during pregnancy, care during childbirth, and also the around nutrition and the psychosocial factors during this COVID, the pandemic. Now, just as a piece of information, we have, as on today, around 25 million births are happening every year in the country. And looking at the present scenario of the COVID-19, at least we have to make some kind of a special plan for coming 2 months. We have a lockdown period, and then even after the lockdown period, there is a threat perception. The health system is going to be overwhelmed. So I think we might have to make some preparation, some guidance, at least for the coming 2 months. So, keeping that point in mind, the government of India has kind of issued the guidelines that the MCH services, they are the essential services, particularly for the pregnant woman in the last trimester and the high-risk pregnant woman during the COVID pandemic. Mansi, can I have the first slide? If you look at this slide, I have tried to mention, that maternal and child health services, they have been identified as the essential services. And communication in this regard has gone across the country, and all the healthcare providers, they have also been, informed about it. Now, besides that, another important point to note, particularly for this community who is dealing with the health of the mother and the children, there is no enough evidence that this particular population is at more risk than the general population. So the risk is same as the general population. And another important point to note is that there is no evidence of risk during vaginal delivery, because sometimes what happens, people might think if the mother is a suspected, COVID positive or a confirmed positive, she may not have to undergo vaginal delivery. But there's no enough evidence to indicate that there is a risk during the vaginal delivery. And also there is no evidence that there is a vertical transmission, which is called as the perinatal transmission. These are some of those important parameters, while making those guidelines. Now, prevention of infection, obviously during pregnancy, nutrition, psychological support, well-being of the mother during this crisis situation is of a paramount importance, and this has a bearing on the MCH outcome. Next slide, please. Can I have the next slide, Mansi?
Yes, sir. Sir,
now another important point to note is that the pregnant woman with no identified complication should be advised to delay routine ANC visits, because at this point of time, we do not have treatment options, we do not have vaccines, and the only option available is the preventing infection. And the preventing infection can happen by using simple approaches like, social distancing. And that means the recommendation by the government of India that the routine ANC visit could be delayed, but inform the ASHA worker telephonically about any complication related to the pregnancy or with fever or with the cough. So we are trying to make use. Beside that, as you all may be aware, that under the government of India's program, where we deal with the 25 million pregnancies every year, roughly, which comes to around 2 million pregnancies every month. And we also have a program called as the Pradhan Mantri Surakshit Matritva Abhiyan, PMSMA. And we also have these all pregnancy related services. They happen in the village level, which is called as the Village Health, Sanitation and the Nutrition Day. Now, all these services where people are crowded together. So many mothers come and report to these facilities. These have been suspended because of the reason of social distancing. This was another kind of a communication which has been sent to the states. But if the pregnant woman proactively seek ANC services on the PMSMA day, they may be provided antenatal care, including the tetanus toxoid injection can also be given as per the protocol, following all the infection control measures. Next slide. Another important point, because particularly we want a lot of they have been asked to list and follow up all high-risk pregnancies to ensure early detection of the complications and their referral and the follow-up, because these are the high-risk pregnant women which may land up in complication, and we may lose mother or we may lose the newborn. So that's why special attention in terms of line listing, and even the telephonic contact by ASHA to the pregnant women the last trimester is also being encouraged by our field work. They have who are to be delivered in the next 2 months. I mean, they are to be linked with the appropriate health facilities for delivery, because their linkages are also important. The next slide. Next slide. Now, another important point which I thought of mentioning here is, because sometime during these crisis situation, the healthcare community might think that they might have to go for a cesarean section. We do not have enough evidence that these obstetric emergencies they require cesarean section. They can be managed based on the available medical assessment, based on the available protocol. So no need for unnecessary cesarean section during this COVID outbreak. And in case of home delivery, telephone are also available. Next slide. And then the in terms of the medical, next slide, medical and the surgical abortion services, they are also to be ensured, and infection prevention measures, including counseling for the post-abortion care. This is another important area which gets neglected during these unusual situations like COVID episode. I mean, the abortion is also one of the important reason of maternal mortality, and these services need to be continued. And another very important point to mention to this MCH community is in terms of early initiation of the breastfeeding and the KM. Available evidence indicate that there is no perinatal transmission. Available evidence also indicate that the breast milk of a mother does not contain virus when the available evidence indicates. But when the mother is breastfeeding the child, she can use the mask, and she can use all hand hygiene and the cuff hygiene measures. So basic concept has to be used, but she can continue to breastfeed. And similarly, in terms of the immunization services, they also need to be continued at the facility level. But however, because large number of immunizations they are happening in the outreach, they are happening at the village health and sanitation nutrition days. They have been postponed till April 15, 2020. And we will communicate, but all these, and the ASHA need to inform all the children. Next slide. Can I have next slide? to the household with the children as per the immunization schedule, and they can access the immunization services at the nearest, the sub health center or the primary health center. So basically, we are talking about immunization services at the facility level. And similarly is the case with the admission to the newborn, sick newborns. And sick newborns, they can be continued to be admitted, all sick newborn. And even the sick newborn and the mother with the suspected or the proven COVID-19 infection is to be managed in a separate isolation facility. That's why, there are recommendations in terms of creating a dedicated COVID hospitals, or there are also provisions in terms of identifying a dedicated isolation facilities within the hospital. Because as you know, the infectiousness of this COVID infection is very high. The next slide. And then the nutrition and the next slide. Nutrition, academic and the private sector community should continue to provide service to the mother reporting to the facility by adopting all infection control measures. And in case of a suspected COVID-19 infection, there is a very standard case definition is available. And even for a sick child, ASHA and the ANM should refer to the nearest COVID-19 management facility and also must notify. And then all healthcare providers must follow the infection control measures and identify early suspects of the COVID-19 based on the standard case definition. I will not, talk about the standard case definition because these case definitions are well known to all of you. But there is a lot of, kind of a emphasis given on the travel history. This is also, one of the criteria which is kept in the standard guidelines. And also if the mother has a contact with a positive case. Now, beside that, there are dedicated, kind of a 108 ambulatory services. Journey expresses are available for all pregnant women during the emergency situation. And then for any COVID-19 related guidance, there is a helpline number is given, which is 1075. And even there is a dedicated number, which has also been mentioned as 239-78046. And in terms of the COVID-19 psychosocial behavior helpline, even a dedicated mobile number is also available from NIMHAS. So these are the important the contact number which can be used. The last slide, Mansi. Now these are 5 critical messages I would like to give to the community, to the private sector, to the nutrition community, to the healthcare providers, providing services to the pregnant woman and to the newborn. That there's no enough evidence that the pregnant women do not have extra risk during the COVID-19, and there is no current evidence to suggest transplacental transmission, and even the no traces of the virus found in the breast milk, and there's no risk during the vaginal delivery. I would like to emphasize on these points as a take-home message. And then the pregnant woman must take all precaution to prevent infection. And the kind of the method which is being talked about during the lockdown period is the social distancing. It talks about hand washing. It talks about cough hygiene. And in a similar note, the health of the healthcare provider is also very critical. They also must take all desired infection control, or this called as personal protection measures. And all suspected COVID cases or positive mother to be notified. I think notification is very critical at this point of time. We need to monitor the progress of this outbreak, the progress of this pandemic, and they have to be managed in the isolation unit using the infection control practices. And all pregnant women must take care of the nutrition, mental well-being, physical activity, adequate sleep within the house during the lockdown situation. It's a very kind of unusual situation which has come up. Next slides. Now, these are some of the slides which are available, particularly in terms of the breastfeeding. I think most of the points I have already covered, but these are the infographics which are available, that one has to continue breastfeeding with precaution to protect from the infection. You see the pregnant woman, she's the mother, and she has a baby in her lap, and she's using the mask, and then she can use all those cough hygiene and the hand washing practices. That's why seek early medical care, wash hands for 40 seconds, routine disinfectant and any surface has to be touched, has to be clean, and use mask. So these are some of the slides which one can use as infographic, and they can be placed in the the clinics, in the hospital facilities, so that there's no apprehension. So thank you very much, all of you. Yeah, basically for a nutrition management, there are two kind of approaches which are being followed. One is, we have the Anganwadi centers across the country where supplementary nutrition is provided to all the children, and particularly for the undernourished children, a kind of double nutrition is being provided. So that's one kind of approach. And another approach is that we have the nutrition rehabilitation centers where the all undernourished children get admitted. Now these are the two places where nutrition management happens. But in all these situations, the important message is that one has to avoid overcrowding. And particularly at the Anganwadis, all the children come together. So all these activities have been suspended for the time being. Even for the NRCs, NRC is a routine activity. The routine activities, even at the NRCs, have been suspended. Even the routine operations, routine hospitalizations, they have been suspended. Routine OPDs have been suspended. But if you find if a child who is undernourished and with a medical complication, they can very well attend these emergencies. The protocol, which is very simple and which I will again, kind of emphasize, particularly for the help of these community workers, that, they need to, make a visit to the different families. Even the schedule has been made. And while making visit, they have to find out a family in the last 2 weeks, who has traveled from outside. So there is a history of travel. Now, history of international travel. So those families are being identified. And then in those families, they have been asked to do a self-quarantine if there is a history of travel. And then if they have any symptoms of cough, fever, or kind of a dyspnea or difficulty in breathing, they have been asked to report immediately. And then the ASHA workers and the Anganwadi workers, they are referring them to the nearest health facility where the medical officer is available. Immunization services is a very critical service. And as you know, there is a kind of a lot of priority given in terms of vaccination. But at this point of time, the immunization services are available at the nearest health facilities. And the nearest health facilities they could be sub-centers, they could be primary health centers, and people can, make visit to those places. Because generally in our field situation, Anganwadi workers, they collect all the children at the Anganwadi, and the ANM from the sub-center, they visit that particular village and they give immunization services. But because that has been suspended, now people can proactively go to the facilities and get their vaccinations. So this is the arrangement which has been made for the time being.